Hello, my name is Kimberly and I just want to tell you about my experience with preeclampsia. I was diagnosed with preeclampsia at the end of my second trimester with my first child. My doctor was very good at explaining exactly what preeclampsia is and how that could affect me and my child. I did my own research so that I could be knowledgeable, and if I had any questions, I could ask and I would know what questions to ask. So I would suggest that if you're experiencing anything during your pregnancy, that you just do a little research just to have some knowledge yourself so that you can take that back to your doctor and ask them questions. Because if you don't know anything, you may not know what to ask. So I would suggest that you would do that. Now with my first child, after finding out I had preeclampsia, my doctor gave me some dietary restrictions, and he just wanted me to limit my sodium intake because I had some swelling and my blood pressure had gone up. And that did work up until I was about 35 weeks, almost 36 weeks, until my blood pressure had spiked too high and I had to have my child via C-section. And it was very scary. The doctors were great. They explained that they didn't want to put me or my child in harm's way, so they had to take the baby via C-section that day. When I came in, I received some follow-up care from my OBGYN and my primary care physician. I did take blood pressure medication for about a month after giving birth, but my blood pressure had pretty much gone back to normal fairly quickly with my first child. With my second child, because I was high risk from the previous pregnancy, they were more precautious and they gave me baby aspirin, and I took that every day. I had my own blood pressure cuff, which I took my blood pressure every day, just to make sure that there were no fluctuations, and I had to give that information to my OBGYN just to keep them aware of my daily progress. And everything was great up until about 38 weeks, when my blood pressure had gone up just a little bit, still within normal range, but because of my history, the doctor wanted to be cautious, and I agreed, because although my goal was to make it full term, my ultimate goal is for me to be healthy and for my child to be healthy. So we had a scheduled C-section. Everything was fine. I was discharged to go home. And then a few days later, exactly 1 week after delivery, I was back in the hospital because my blood pressure had spiked again. I was not aware that you could have preeclampsia postpartum. And I'm thankful that we did not wait, because that could have put me and my child in danger. The hospital was great. The doctors were great. They took care of me. They allowed me to come back with my child in the hospital as long as someone was there with me to help me take care of them. But they pitched in too to help with the baby in the middle of the night. So they were great, and I appreciated the support. Once I was discharged for the second time, I did receive care from a visiting nurse in my home. I also had follow-up care with my primary care physician and OBGYN just to make sure everything was going well. I was on blood pressure medication, and this time it did take much longer for my blood pressure to return to normal. But I received great care. What I would recommend for mothers is always go to your prenatal visits. Do your own research so that you can ask knowledgeable questions. Don't be afraid to ask your doctors questions, to ask them what is important to you, because this is your child, this is your body. You should be able to ask questions.